Hey there, my name is Sarah. I am a naturopathic doctor practicing in Toronto, Ontario. In this video, I'm going to cover 6 questions you should ask yourself to help you decide if you should become a naturopathic doctor. The questions are organized in increasing order of importance. This is going to be a really long video, but if you get through it all and you end up saying yes to a majority of the questions, then congratulations. Naturopathic medicine is a profession you'll probably enjoy. But if you end up saying no to a majority of the questions, then you might want to consider looking into a different career. Be honest with yourself when you answer these questions. If you aren't honest with yourself right now, you might end up in a profession you won't enjoy. Now, of course, this is just my opinion based on my own experience as a naturopathic doctor, so keep that in mind. Other naturopathic doctors may or may not agree with what I have to say. I also want to mention that this video is being made with the assumption that you, the person who is considering naturopathic medicine, you have already decided to commit yourself to helping people optimize their health. Being any healthcare provider is a really big responsibility, and if you aren't ready for that level of responsibility, then perhaps you don't need to watch the rest of this video. But if you are ready for that responsibility, then keep on watching. Enough of the preamble, let's get to question 1. Question 1, are you genuinely curious about all of naturopathic medicine? I'll start this part off by saying it's fairly easy to get into naturopathic medical school. The thing is, it's pretty hard to stay in naturopathic medical school. In my first year, there were quite a few people who dropped out. And in the second year, there were less people who dropped out, but still some. And in my third year, I think 2 people dropped out. And from what I understand, some of them dropped out because they discovered they are not interested in learning all of medicine, only a part of medicine. A lot of people go into naturopathic medicine because they're interested in botanical herbs, they're interested in nutrition. Some really like acupuncture and Asian medicine. That's all in naturopathic medicine. But there's way more to naturopathic medicine than your favorite subjects. It includes subjects like pharmacology and minor surgery. And I know there's a lot of people who go into naturopathic medicine because they want to avoid studying pharmacology. The thing is, when you see patients, a large majority of your patients will already be on prescription medications. And you're going to have to know the potential side effects and drug interactions of these prescriptions before making any recommendations to your patients. I want to give you a different example of one of my classmates who dropped out in first year. He thought naturopathic medicine was going to be about telling people what to eat and what not to eat and what supplements to take. And that is part of the job. However, he didn't realize how hands-on you have to be as a naturopathic doctor. He didn't like the part of having to check people's blood pressure, to listen to people's hearts, to look in people's ears, look up people's nose. Naturopathic medicine involves pretty invasive physical exams like vaginal exams, rectal exams, breast exams. And if you're not comfortable with doing those things, naturopathic medicine isn't for you because you have to learn that stuff. So my classmate decided to become a holistic nutritionist because it's a profession where you verbally help people and it's much less hands-on. I want to emphasize the importance of this question because as someone who is really interested in learning all about medicine, even though I'm interested, the material I had to learn was quite overwhelming. There's just so much you have to learn. And if you're only interested in studying a part of this huge amount of information you have to learn in 4 years, then naturopathic med school is gonna be a drag. It's gonna be super hard and you're going to find it very hard to motivate yourself and be satisfied with all the studying you have to do. And the studying doesn't end when you graduate. You're gonna have to continue doing self-study throughout your career. And unfortunately, there are very, very few residency programs after you graduate from naturopathic medical school. And because of that, naturopathic doctors, they don't get much hand-holding through their first years of practice. You're basically on your own, and you need to have that self-motivation to look into areas of medicine that you might not originally be interested in. So identify if you're interested in only a part of naturopathic medicine. If you are, get into a career just focused on that part. But if you like it all, then naturopathic medicine is for you. Question 2, are you willing to take work home? This is a question not many people think about. It certainly wasn't a question that I thought about before I chose naturopathic medicine, but now that I'm a naturopathic doctor, I think it is a very important question to ask yourself. For a lot of people, the ideal job is one where you go to your job, you do your job, and then when you come back home, you don't have to think about your job at all. And if this clear separation of work life and home life is what you desire, then you probably shouldn't go into naturopathic medicine. Because as hard as I try to keep my work here in the clinic, it always seeps into my home life. And you just gotta be okay with that if you're a naturopathic doctor. Now, what kind of work am I doing at home? Well, before I go to clinic, I like to prepare for my patients. I usually review their charts, and I want to make a treatment plan ready for them so they have treatment ready when they come in. If they already have a treatment plan, I still think of alternative backup ideas for them in case the original treatment plan hasn't worked out for them. So that's before I go into clinic. And then I go into clinic, I see my patient, but then after I see my patient, I go home and I need to document and chart what happened in the appointment. And then if necessary, I'll spend a couple hours researching into the patient's condition and potential treatments. All of that preparation takes time, and it usually happens when you're at home on your days off. And I want to make a very important note here, because financially speaking, all this extra work that you do for your patients is unpaid work. Let me give you specific numbers. In Toronto, the average price for the initial appointment to see a naturopathic doctor is $200 for a 1-hour session. Now, if you are an independent contractor and you're being paid by commission, you're probably going to get maybe 60% of that $200. So $120 for that hour. And you might think, holy crap, that's a lot of money, $120 per hour? Sign me up, baby. I want to be a naturopathic doctor today. But you need to factor in all the time you spend away from the patient behind the scenes. You might spend an hour documenting the appointment. You might spend 2 hours doing research for that patient. And then after you do that research, you might spend another hour writing up a treatment plan for them. That's another 4 hours that you spend on that patient. If you add in that initial hour when you see them in clinic, that's 5 hours of work for $120. If you do the math and divide 120 by 5 hours, that's only $24 per hour. So if you are okay with that mathematics and kind of doing work for free, then hey, naturopathic medicine is okay. Also keep in mind, since you have to do a lot of extra work at home, you're going to want to make room for that work in your schedule. So you might originally think that, oh, I want to work 5 days a week in the clinic and take 2 days off. In my opinion, I think you should work 4 days in clinic, spend 1 day at home doing all the behind the scenes work, and that will give you at least 1 or 2 days of rest and relaxation. Okay, question 3, are you a business person? After 4 years of school and a year of studying for your board exams, you're gonna be pretty eager to start seeing your first patient. The thing is, there are no hospital jobs for naturopathic doctors. To get a job, you either have to start your own clinic or you have to join a private clinic as an independent contractor. Alternatively, you could start your own supplement company or you can be a naturopathic consultant at a already existing supplement company. But regardless, you are in charge of your own job security. And that means you have to either already be a business-oriented person, or you have to go up a real steep learning curve and learn to become a business-oriented person. And running your own business, well, medical practice, is not something that is taught in naturopathic medical school. At my school, I only got one course on how to build your own practice, and it wasn't that good. To learn more about running a business, you need to listen to business podcasts. You need to read business books. You need to speak to experienced naturopathic doctors and ask them how they've been running their practice. And keep in mind, running a medical business is different from running a standard business that does not have to follow medical ethics. As a medical professional, there are very specific rules and regulations you need to follow, and these regulations can make it more difficult for you to bring new patients to your practice. Let me give you an example. For standard businesses, they can post customer testimonials on a product or service and post it on their website to draw more people in. That's their marketing strategy. But for healthcare professionals, it's unethical to use patient testimonials and post it on your website to draw patients in. And in this world where we all heavily rely on reading reviews to make major decisions, it'll be hard for people to know that you are a naturopathic doctor worth seeing if you aren't able or allowed to display that you have helped other people in the past. So that's something about running a medical business that can get in the way of your business growth. Another thing to keep in mind about running a naturopathic practice is that people don't like paying out of pocket. Even if their health is really, really bad, the last thing that they want to do is pay for something out of pocket. Here in Canada, Canadians are very used to free healthcare. People call up their medical doctor, book an appointment, and they don't worry about how much the appointment's going to be. They show up, see the doctor, and they go home happy. But for naturopathic services, they aren't covered, so people either have to pay out of pocket or they only use up the very limited amount of money that they get from their private health insurance. And usually that's just about $500 a year. So what does that mean for a new naturopathic doctor? This all means that it's incredibly hard to draw patients in because health businesses need to run differently than standard businesses. And number two, since people have to pay out of pocket, once you get a patient, it's hard to keep the patient. You need to be extra on top of your medical game. You need to be sure that you're doing everything right and that the patient is actually getting better, because if they don't, they're not going to come to see you anymore. They are not going to spend their money on you. And why should they? On average, it takes about 5 years for a naturopathic doctor to build up a new practice large enough to feel like they are financially secure. But that's just an estimated amount of time. It could take more or less time depending on your own ability and ambition to grow a successful business. And in the meantime, if you don't come from a wealthy family, this means you have to live below your means for a few years before you can make the big bucks and go on those extravagant vacations you've dreamed of. Go out to eat every single weekend. You won't be able to do that until your business is up and running. Some people are frightened by this idea and don't want to make all the sacrifices necessary to grow a business. But then there are other people who are extraordinarily excited to grow their own business and make these sacrifices. And if you're one of those people, naturopathic medicine is the right job for you. Question 4, are you a patient person? In other words, are you someone who prefers instant gratification or are okay with delayed gratification? If you prefer instant gratification, don't become a naturopathic doctor. Because if you do enter the profession, it's likely you're going to quit after the first or second year. And I'm not saying that to be dramatic. It happens, and it's okay. I hear stories of naturopathic doctors changing their career after 1 or 2 years of practice. And it's usually because it's really, really hard to grow a business. As naturopathic doctors, we're trained in medicine, not business. So if we're not able to grow a business fast enough, and if we aren't patient enough to see it generate more revenue, then you're likely going to quit. And oftentimes naturopathic doctors quit to go into some other medical field like nursing. So you have to be patient on the business side of things, but you also have to be patient with your patients. Naturopathic doctors usually treat people who have chronic diseases. And when you deal with chronic disease, it takes a long time to see any improvements. If you're lucky, you might notice a change in your patient after 6 months of treatment. And when you see that change, it's amazing. And the patient notices, you notice, everyone notices, and everyone's happy. But more often than not, a lot of patients will say, "Oh yeah, I'll follow your advice, no problem." And then when you see them again at their 1-month follow-up appointment, they'll say something like, "Oh, I didn't have time to cook and eat right. I didn't have time to get the things that you recommended that I buy. Oh, I forgot to take my supplements for the past 2 weeks." And the lack of patient compliance to their treatment plan can further delay yourself and them in seeing a positive outcome. And this can be very discouraging at times. So if you are someone who likes instant gratification, then you might want to consider going into conventional medical school where you can become an ER doctor and really see your impact right away. Perhaps you can go into chiropractic medicine or massage therapy. Those are professions where the practitioner and the patient can immediately see improvement in symptoms right after the first treatment. But if you are someone who likes to be with a patient for the long haul, you want to be there on their long journey to recovery, you want to be that person that is their accountability coach, you want to be the person that brings them motivation and cheerfulness so that they can keep on going, they can keep on growing, then naturopathic medicine is for you, because that's what it's all about. Question 5, do you value humility over prestige? In my experience, when I'm at a gathering and I meet someone new and they introduce themselves as a medical doctor, what I've noticed is people usually respond in awe and admiration. They'll say things like, "Oh my goodness, you must be so smart," or "Oh my goodness, you must be so hardworking." And to be honest, most medical doctors are very smart and hardworking. You have to be in order to get through med school. And I think it's great that people acknowledge these traits in medical doctors. However, if you are someone who is seeking the same kind of validation and respect and admiration, you shouldn't become a naturopathic doctor. Because whenever I introduce myself at a gathering and I say, "I'm a naturopathic doctor," most people stare at me blankly and ask, "What the heck is that?" While there's an increase in demand for non-pharmacological treatments, people don't know that naturopathic doctors exist to provide non-pharmacological treatments. And since the general public doesn't know that this profession even exists, then you can't expect any acknowledgement or admiration for what we do. So even though you've worked hard to be a doctor and you've helped hundreds of people with chronic disease, do not expect a pat on the back from society in the same way society admires pharmacists, medical doctors, nurses, nurse practitioners, physiotherapists. I don't think that acknowledgement is going to come for a long time. If you become a naturopathic doctor, you're going to have to constantly resist society's pressure to pursue prestige and status. And it's tough. The thing that has helped me stay grounded is to focus on my patients. I only really care about what my family, what my colleagues, and what my patients think of me. If I know that they believe that I'm here to help them, then that is enough for me. And hopefully it will be enough for you. Question 6. Do you have thick skin? If your answer is no, then are you willing to grow thick skin? I think this is the most important question to ask yourself, because negative naturopathic criticism will wear you down to the ground if you let it. Because after all the studying that you do in school, after all the hard work you're going to put into growing your business, after all the patients you're going to be working on in clinic and at home, after living below your means for several years so that you can stay afloat and keep on practicing, and after all the patients you help in practice, there are going to be people who, despite all the good work that you do, there are going to be people who say you're a fake doctor. They might be complete strangers online, but they also might be family members and friends. Naturopathic haters exist. They will say that you're duping people into giving you money. They'll say that you're an idiot and that you should find a different job. They'll say naturopathic medicine isn't real medicine. All of this stuff is going to hurt. And you're probably going to want to change their minds. You're going to want to explain yourself, tell them about all the education that you have. Don't bother. None of it is going to convince them to believe that you are actually here to help people. In this age of social media, misinformation spreads like wildfire. And there is a lot of misinformation about naturopathic doctors. I think most of the hate that I've gotten for being a naturopathic doctor was based on misinformation. But people don't know that it's inaccurate information, so the reputation of naturopathic doctors has already been tarnished. But what are we going to do about it? Are we going to let haters dictate what we choose to study? Haters will say that naturopathic medicine is not evidence-based. Well, if that were true, then who's going to study it? Who's going to investigate if something natural is effective or safe? We are. Naturopathic doctors are going to look into it. Haters will say it's not a popular profession. Well, who's going to make it popular? They're not going to make it popular, obviously. We're going to make it popular because we have an interest in it and we're going to share our interests with everybody. And this is why I'm here on YouTube making these videos. I want people to see the real side of naturopathic medicine. I want to make videos that put out accurate information about the profession to counteract the misinformation that's been spreading around and kind of bringing down the reputation of naturopathic doctors. But most importantly, I'm making these videos to strengthen my own courage and be less afraid to speak about important things like this. And if you're into that too, if you're into growing thicker skin and strengthening your courage, despite all the hate that's out there, I think you'll do well as a naturopathic doctor. Okay, there you go. Those are the 6 questions. How are you feeling? Excited? Discouraged? If you're feeling discouraged, please don't be. I didn't make this video to discourage people from joining the profession. I made this video to manage expectations, to show the reality of the job. It isn't a job that's all glamorous. But then again, there is no job that is 100% glamorous. There are hardships in every single profession. But I hope this video helps you decide if the hardships of this particular profession are things that you're willing to work through in order to help patients improve their health. And if this job isn't your cup of tea, that's okay. Maybe down the road it might be a career for you. I know many people who have decided to choose naturopathic medicine as their second career. There were many nurses in my class. There was a former lawyer, a former pharmacist, and many former medical doctors who decided to get into naturopathic medical school in their 40s and 50s. So it's never too late to join the profession. You can join it later if you don't think it's right for you right now. Anyhow, thank you so much for watching this crazy long video. Please give it a thumbs up if you have found it helpful, and hit subscribe if you want to see more videos like this in the future. Okay, bye!